Right. Welcome everyone to Institute of Politics YouTube channel. My name is James Talberg, and I'm today with Marina Trinkova going to discuss a little bit about taxes, how they're spent, how they're organized, how they're paid by the taxpayers, and later organized by the government and the federal government. Marina, thank you so much for joining me today.
Thank you for having me. Hello.
Right. So, Marina, I want to talk with you about the tax system because you're currently living in the US, and I want to break down the US tax system and just comparing to other countries that you've been living before, the country that I live myself at the moment, Canada, just for us to understand how the taxes are collected, how they're spent, and in what quantities they're spent. So, I've prepped for us a little format just to simplify that. And make it a little bit more organized and easier to digest and understand. So, what I did, I found 6 main categories of the federal programs that the US is spending the tax that the taxpayers are paying to the state. So, in the categories that I found, I have healthcare, social security, defense, income security, interest on the debt, because United States has a national debt, and other categories like veterans benefits, transportation, and education. So what I'm proposing here to do is to kind of like transition, because everybody pays different amount of money in taxes. Somebody's paying 20,000, somebody's paying 10,000 a year in taxes, just to convert it into one kind of like system, so it's easier to understand for everybody how much of their tax is spent on what federal program. So I'm proposing to convert it into 100% of the tax payments, and we can call it a simple $100 bill, right? So like, let's say if you pay just a symbolic $100 bill, let's say you've paid $100 in taxes in a year, how much of that $100 will go to what federal program? So we have the first one that is quite big, $28 to $32 out of that $100 goes into healthcare programs, Medicare and Medicaid. Just a basic question. What is the difference between Medicare and Medicaid, and what are they for those who are not from the United States and they're not quite familiar with the system?
I believe that those two programs are for people with the low income. They provide health care services support.
Sir, just to interrupt here a little bit, when you say low income, you have to be from a low income family or be considered as a low income individual to have the access to those programs.
Exactly. You have to fill some documents, and the most important part of those documents will be your income. Not just your personal income, but household income. And if it is lower than average, if you are vulnerable representative of the United States communities, government supports you in absolutely different ways. Medicaid supports healthcare services. There are some food stamps or welfare stamps where government provides for free food for those people, and special insurance programs. But you really have to be below
a certain income to qualify. So let's say if I'm just a little bit above that income to be qualified, that's it. I don't have any potential access to those governmental services to get.
No way, James. No way. You cannot even dream about that. In this country, average American, they will sleep well, not thinking about healthcare services, into if they have 2 kinds of healthcare insurance: government, Medicaid, or any insurance which could be provided by Native American enterprises. Basically, any private enterprise which belongs to Native Americans. They have their own attitude to healthcare, more closer to our understanding. And people who are lucky to work for Native Americans, they are extremely happy with insurance they have as an employee.
And just if we can, try and understand how much does that cost to go to receive any healthcare service. Let's say I've got a flu and I just want to go get tested with a family physician or any other pediatrician. How much that average bill would cost me just to go that to get
You
that check
take
in?
me. I mean, fact check on the basis of my last visit. I don't have any government or Native Americans insurance. I have an average insurance which pays me, covers 30% of the bill. I had not flu, something a bit more
But still basic,
serious.
nothing
Right.
dramatic. You don't have to get a
Two
surgery.
No, the first visit, just a visit without any medication,
Yeah,
drugs,
just
or
for a check-in.
anything.
Yeah.
Yep. It cost me $278. And my insurance covered just 30% of it.
30% of it. So,
One visit, one. And that means that hopefully, hopefully after the one a visit to doctor, everything is
everything is
fine.
okay. Yeah.
But normally, it is not how a human being body works.
Yeah, you would like a
Plus,
follow-up and maybe additional check-in. Yeah.
absolutely. Please note that an average receipt from a pharmacy after visit at the doctor approximately is going to be 150, 190. And now you can do the math.
So an average bill is about $200 for a check-in. And I just want to get a little bit more clarity. When you go to a physician for that regular check-in that you by yourself had lately done, is that the same facility, the same clinic that a person that is considered to be a low-income individual that can get access to those physicians, or those are two different directions and two different clinics?
No,
The
no.
exact same place.
The same place, because it would be regarded as discrimination. Basically, me can visit the same clinic with
Yeah, I get it. I just
people
wanted
with, yeah.
to clarify if they have a different clinic that they can go to, or that's the exact same facility. So if it's the exact same facility, and again, referring back to then on those facilities that you have to pay because you're not considered as a low income individual, and some people can have access if they are falling into those programs. How would you describe the service in general? Do you feel like 30% of the taxes are going there? Like, how is the facility in terms of like technology? Do they have all the tech up to date? Are all the physicians, you can tell you're confident to discuss with them your like, illnesses and whatever challenges you have in the moment? Or you can say, oh, like, wait, they like, there is an opportunity for improvement. I don't feel like 30% of the federal budget is being allocated here.
Right. Let me divide my answers in several parts. As far as the equipment, technologies are concerned, everything is really fine. The professionalism of doctors is absolutely fine. But normally, if I had a cold, a flu, I would not go to any doctor because I'm an experienced person. I know what to do, but I have to go and to visit doctor only to get prescription. Now, if
So
I'm
I have to stop you here. So if you want to buy some drugs from the pharmacy, you cannot do that without prescription.
no,
So
if
you're
it is
kind
a
of like,
serious drugs,
yeah.
if it is a serious drugs,
What's considered to be a serious drug?
antibiotics,
Antibiotics
or
considered to be a serious drug.
yep, yep,
So let's say
or
if you're
any
sick,
strong anti-cold or anti-flu stuff, it's going to be really serious and helpful. You
yeah.
have to go to the doctor. Basically, James, if you you will understand me. I am going to the hospital not because I don't know what to do. I'm
You
going
have to.
just for the prescription.
Yeah.
That means that I am paying just for
Prescription.
prescription.
Yeah.
and drugs more than $500 minus 30% because I'm covered. I'm 30% covered. Now, please imagine the situation if you are in Munich, in Edinburgh, in Glasgow, I don't know, even in Ukraine, you go to the pharmacy just
And you just
to
buy it. Yeah.
buy
Yeah.
for huge amount of money something you know, something you've been through.
I mean, I do support a certain protection in terms of, not all the drugs supposed to be outside of prescription and can be bought and used just by, somebody's will. But definitely when it's something simple, it's kind of giving you that feeling that you're trapped to go to the physician to get the
Of course,
prescription.
my personal view is that big pharma is extremely linked to all healthcare infrastructure. And that is something which is impossible to divide. You have to cut, like from the
Yeah.
Greece myth.
So yeah, it would be good to separate it so you don't have to participate in that loop where you have to always pay
Yep.
to the physician. Just to give it a comparison, like in United States, you've mentioned that only if you're a low income individual, you're qualified to avoid paying those $200 bills for each simple visit where you want to get a certain prescription. I know approximately here in Canada, we pay not we pay, but from the general sum of money that the government gets from the taxes, they spend 21 to 25% of that budget into healthcare. But our healthcare is universal. Like a lot of people are complaining about it. We have long wait times. It's not perfect. It's overused and overloaded. But yet it's about same or even less percentage in terms of
Yep.
the governmental budget, where I don't have to do that. Like I have the exact same situation where I do have to get prescription and I have to go to get the visit to a physician to get that prescription to buy it from the pharmacy, but I don't have to pay those $200, right? Like,
hold on a second. $200. It's just for the pharmacy services, but almost $300 for visit.
yeah, I
In
mean, so
total,
I've meant
yeah,
the visit. Yeah, I've meant the visit. Like I still have to pay for the drugs, but at least I can skip that $200-300 bill to the
right.
physician to get the prescription, right? All right, so that makes a clear sense in terms of how that works. In terms of social security, we have 22 to 25%, or 22 to $25 from that $100 bill goes into social security. Do you have anybody who receives social security? Do you have any understanding how that works?
I don't, but I know that I'm paying taxes towards Social Security as well.
So it goes there.
My
Yeah.
understanding, and that is not perfect understanding, and I totally might be wrong, but my understanding that Social Security, it's a minimum solidarity pension fund, and if something, excuse me, something goes wrong with your private investment in pensions fund, you will be able at least to
What's
maintain
what's the
your
eligibility? Like who's eligible to receive those social security
everyone
services?
who was everyone who is paying
Is it
tax.
above certain age, or like if something happens to you?
No, since you have a social security number and since you are employed, you are paying part of your income to social
So
security,
it's
and then they
disabled.
pay you back
Yeah.
after 65 or 70. I don't remember. I just don't know.
Would you know what's the check, or that varies from like how much you were paying in taxes? Let's say if somebody's paying 100,000 a year, like their social security benefit will be higher, or that's kind of like universal, no matter how much
I
you
don't
pay.
know. I have to tell you, I was not even interested to explore yet.
That's okay. Yeah, we can definitely skip this one. I was just curious if maybe you have somebody that is using that social security program, or any of them. In terms of defense, United States is spending $12 to $16 that is allocated into national defense, covering military personnel, operations, and equipment. Do you think that also includes their overseas operations or their overseas support to their allies like Israel, Ukraine, Japan, or that just specifically goes into the US Army, their equipment, their operations, just strictly to the United States?
Oh, I think that topic is extremely foggy, if I may say so. Because if that's, by the way, it would be a very good topic to discuss together with Ruslan. Because I was reading some analytics, James, and I was terrified to understand that since, let's say, since 2000, the United States of America spent on overseas 5 trillion
A
dollars.
good amount of money. So do you
Yeah,
think that 5
and
trillion
that
comes
is
out of
only
that budget?
overseas. I have no slightest idea. I cannot do any decent comment on that. But again, let us come back to math, right? 5 trillions during the last 20 years. The majority of the overseas operations failed. Afghanistan, Iraq failed. Plus, my understanding that veteran organizations, they have planned already to spend 2 trillion on veterans' health issues,
Benefits and
bringing us
support.
back
Yeah.
to healthcare. Yeah.
Yeah.
Statistics says that overall per household, and that means that per household, mine household as well, it is about $40,000. Every household in the United States of America, a very rich one or middle class, paid to those overseas
Operations.
interactions,
Yeah. Operations.
operations, or whatever, $40,000
In total, not like on average a year, but in total.
in total.
It's a good
But
amount of
okay,
money.
we can go even better. We can go down with the math. Math is lovely science. 40,000 we can divide for 20 years of extremely unsuccessful foreign policy of the United States of America, and we can come up even per day.
With a better number. That's gonna make it what, 2,000 a year from each single family?
I believe we should discuss that separately because, James, let me remind us, we're talking here about healthcare, taxes, social securities, and that is separate topic. And
Make it
we
a
need,
separate foreign policy topic. I
yep,
agree. We're running a little bit out of time, and I just want to fully cover the breakdown with a tax situation. So after the defense, we have income security and other benefits that are spent approximately $13 to $16 out of that $100 bill, and that goes into housing aid, food assistance, what you've mentioned before, that the
yep.
low income individuals are eligible to apply for that, including unemployment benefits and other security programs. Do you have anything, any insights how that works that you can share with us in terms of those systems and those programs?
What I know from my experience that those programs are extremely active for the immigrant communities. They are supporting. By the way, education is quite consuming part of taxes as well. We are talking not about school for the citizens. We are talking about different courses, absolutely different supporting training programs for the immigrant
Refugees,
communities.
newcomers,
Yep,
all of those groups.
yep.
Would you
And
say that
that
they're
is extreme. That is, again, a separate topic to discuss. Because look, I'm not judgmental, right?
yeah,
But I have my own experience and my personal views on efficiency of all those
exactly.
programs.
That's exactly. I just like that's my question, right? From your personal perspective, would you say that those programs that are eating 13 to 16% out of the entire federal budget, are they effective or they can do better?
They are not effective, and to do better they have to be, no, they, all those programs have to be heavily restructured. They do not work anymore because they are not tailored up to the psychology and mentality of people.
Or maybe they're just not updated up to date and they have been invented and created like, I don't know, 20, 30, 40 years ago.
I believe we have to look at that issue a bit more specifically, because I will be straightforward. I believe that policy towards refugees and different immigrants is not what the United States deserve to have.
Or the taxpayers' money, per se.
Yep.
And then we have interest on debt that is not quite big. It's only $8 out of $100 bill that we're calculating here that goes on paying on the national debt. I know you're not an expert, you're not an economist, you're not working in the finance sector, but just from your personal perspective, the United States national debt was rising and it's still going up and up every year. And I think every year the Congress has to pass a law to increase the seal on that debt. What do you think is going to be the end story with that national debt? At some point, somebody's going to come in and start, breaking it down and paying it off and switching the trend, or we'll just stay in that loop, increasing the seal and going through that over and over again.
I don't know. I believe that, by the way, overseas operations, they are an instrument to manage that debt as well. I don't know. It's complicated for me to say anything decent because I don't have a financial background, as you correctly mentioned before.
The last category that we have, that's how it's described, other categories, that transportation falls in there, veterans benefits. What caught my eye, and the number that is spent on that, it's $9 from that $100 bills is spent on that category. Transportation. There was that story with the railroad that the United States have spent, $300 billion, and it wasn't finished. It wasn't halfway done, that railroad part. What's happening in terms of the transportation? I don't know what specific percentage out of these $9 is allocated to the transportation, but what is the current state of the infrastructure around transportation?
That is a very good question. That is so timely put question, especially to me. The majority of Americans, they never 99% of Americans, they don't have even foreign passports, so they do not travel. They live in the United States of America, absolutely sure that they have the best infrastructure, the best roads, the best railways.
Are they?
Yep. And 5% or 2% of those who travel, when they come back from their overseas trips, from Europe, from Istanbul, especially from China and Japan nowadays, they just terrified.
They're surprised
by the progress.
Let's
and
put it in a positive.
deterioration.
They're surprised by the progress.
It's not even, excuse me, it's not about surprise. It's shock, I believe. Because, mentally, every empire lives like that, brainwashing its citizens. But, this take will come when people suddenly realize that they are living not in the best country in the world from the infrastructure point of view.
In terms of the infrastructure.
And services point of view.
So what makes that infrastructure not up to date? Like the roads are broken, they're not finishing all their railroads projects. Like what's happening there that prevents them
exactly
from
what you listed?
Exactly everything on the basics.
Listed.
But the amount of money that is spent on it, it's quite high. Even if we take 50% of these $9, let's say $4, 4% of the federal budget that the government has from the taxpayers' money, it's a good amount of money. It's probably enough to fix all those roads, build those railroads. Like what's happening? What do you think needs to be done? Like what type of reform to have that infrastructure built for the convenience of people that pay money for that infrastructure to use?
Okay, let me be absolutely primitive. If you have money, if you understand that you need to fix something, but you don't do anything, and you are in the leadership position, what does that mean? That means you are not capable to lead, you are not capable to put on table draft policy paper, organize people, discuss with people anything which people would like to discuss with
So
you. And that's, by
leadership
the
is the
way,
issue.
sorry?
So leadership is the issue. The money's
I
there,
believe so.
the
I believe
projects are
so.
there. It's just nobody takes that situation under control and starts working it out.
I think so. I mean, it's complicated for me to judge, but my conclusions are extremely close with Mr. Ramaswamy conclusion. Because he says basically about extremely low educational level of those who were elected in states, and in states I mean on the not on the federal level, right? I'm not, and
On a provincial level.
yep.
Right. Marina, thank you so much for your thoughts and comments today, just getting us into the insight how those programs are working, and in terms of if that meets the standard of the money, or like the expectation of the money that is spent into those federal programs. Thank you again.
Thank
And
you.
yeah, and we'll definitely film another episode when we're specifically focusing on the foreign policy.
Thank you so much.